residence doctoran protest kala outside GMC.
Goa Association of Resident Doctors, they given me a letter saying that they would be going on strike from 1 p.m. today. Okay, and in that they have said that they will also do emergency services will be continued. Okay, I as a dean and my medical superintendent and director admin, we understand the sentiments of the guard, and we stand in solidarity with their feelings, because it is about the incidents that has happened in one state of this country, and the doctor community is shaken up. So in this regard, I also had a discussion with our Honorable Health Minister, and he also expressed his sentiments towards the feelings of the guard, and we had meetings of heads of department to see how we can function in this situation. So all HODs have been briefed, and they are ready to carry on the emergency work. Emergency work will not stop. The patients' lives will be saved here. It is very, very important that being a tertiary, we take care of our patients who comes with emergency. So the only routine work, that is routine operations, routine admissions, and elective, we call it elective, this work will be stopped till the time the residents join back.
तर अनेक गजाल आयकपाक येता की IMA फाल्यांच्यान OPD बंद करपाचें म्हणून. सो GMCची OPD बंद आसतली फाल्यां?
आमची OPD कशी आसता ना, आमची OPD बंद अशी आसची ना, बट इट विल बी स्केल्ड डावन, बिकॉज आमचे कडेन दोतोर कमी आसतले न्ही. OPD आतां कोण आयलो, आमचो एक ऑपरेटेड पेशंट पयर ऑपरेट केल्लो, ताच्या पयलीं ऑपरेट केलो, ताका फॉलोअप लागता न्ही, ही बिकम्स अ कायंड ऑफ OPD एमर्जन्सी. सो इन दॅट केस हाव वी कॅन टेल देम यू गो बॅक. So we being catering for so many patients in the state of Goa, आमच्याकडे low scale, very low scale OPDs will function.
So आज
त्यांच्यानी टायमिंग दिला from 1 p.m.
ती कितले दीस म्हणून
ती डेट दिवना तांच्यांनी. I asked them for clarity. What they said, they would like to go with the national association of guard. There are guards association like Goa Association Resident Doctor. There is MARD, Maharashtra Association. So they would like to go with other association, and they will intimate me by evening. And I have also told HODs to be around in the campus, all of them. And SOS, we will take calls, whatever is needed to make this hospital function to save lives, we will do.
What are the demands?
Demands, they say that there are 5 demands, 6 demands they have given. They are asked for impartial, transparent investigation, which will be at the place where the incidents has happened. Then they have also said swift justice to the disease and compensation. They also said no police brutality should happen. Again, at the place where it is happening, formation of expert committee to speed up implementation of Central Healthcare Protection Act, which is being today morning, I think JP Naddaji has already spoken on this. So there is a breaking news on that. So that part again lies with the central government. For us, they are saying improving security measures in the campus. We are on it. Dr. Rajesh Patil, who is the medical superintendent, has already given a brief that all our CCTV cameras are functioning. We have more than 300 cameras. We need to demo them to all the people. We are also going to train our security guards through police force and see that they are really professional, because as of now we find some of them are not that professional, so they will become professional. And also looking at the safety of all the duty rooms and all. So that part we will take care. That is only relevant to our this. They are also saying providing better quality and secure duty rooms. Yes, definitely we will provide, but this campus has got a lot of security in place. This campus has not reported any such incidents in last so many years. So, but still, if it is a demand, we will look into it and we will do it. In fact, we already had one emergency meeting under the MS as a chairperson.
So, हाच्या पयली अशी डिमांड येवंक नाशिल्ली. फर्स्ट टाइम डिमांड केल्या गोवा रिलेटेड जी डिमांड आसा.
गोवा रिलेटेड डिमांड पयलीं सुद्दां काय अशी येऊ ना. आज हे फर्स्ट टाइम आयला म्हणजे त्यांचे म्हणणें कितें की आमच्याकडे सुद्दां हांगा अशी इन्सिडंट्स घडूंक शकता, विच आय डोंट डिनाय, बिकॉज टुडे द सोसायटी इज you see such incidences happening in so many places. So I fully agree with what demands they have put, and we will fulfill them. Suppose it continues, then our routine work will suffer. But emergency work, no way. Emergency, we will be there. All senior doctors will be working. Emergency, we cannot refuse. Even they have agreed that they will do emergency services. Guard has also written here that all emergency services will be continued as usual. Including interns who are on emergency duties, they will also be doing emergency duty. So we are concerned about our patients, which I appreciate on behalf of GARD.
This is the protest of the junior doctors, junior residents and senior residents against the heinous and atrocious rape and murder case that has happened in RGKR College of Kolkata. So we as a doctor from Goa Medical College are protesting in solidarity with the rest of the nation while they are protesting so that the victim might get the immediate justice in RGKR rape and murder case.
This protest is basically to support the national event, and we are requesting for speedy justice, and central government to look into the issue for speedy justice, and we are also hoping to get some law, some central law, so that there is some uniform protection act for all our India doctors, all the healthcare workers rather.
The purpose of this protest is simple. We stand with the nation, we stand with all the doctors who support this noble cause to provide speedy justice to the victim, and so the culprits are reprimanded, they are held responsible, and for the implementation of the Central Protection Act with the Central Ministry to all the government medical hospitals all over India. That is our main goal.
Protest will continue, or we are...
As of now that we have received, we are going to continue with the strike at least till tomorrow, and the whole decision about continuity of the strike will be taken on Sunday evening in conjunction with all the rest of the resident doctor associations all over India.
Till full.
We have suspended all form of routine non-essential services like OPDs, routine OTs. Emergencies, however, will be attended in full strength. No patient will be neglected in that sense.
Apart from this, our security is also security की भी समस्या.
See, as of now, we are not going to specify in general about this. We are only, totally we are trying to show that we are standing in support to the national cause. Here we are not demanding any form of any leverages. We are not going to talk about how it is in each and particular situation. It's not a time to be selfish. We are supporting our colleague who was wrong in front of so many people, and we can see how the things are being dealt in Kolkata. So we expect all of us to support. We expect all the media personals. We expect the non-doctor fraternity, the general public to support us for our cause.
Thank you. तुम्ही किती कंटिन्यू करतले till
स्ट्राईक कंटिन्युटी डिसाईड करतले डिपेंडिंग अपॉन द रेस्ट ऑफ द कंट्री कसे स्ट्राईक करतात त्याप्रमाणे. This as of now till tomorrow, strike is not to harm public. It is so that we raise a voice so that the victim gets a fast justice. कितें लास्ट वीकभर जालें ताका जस्टीस मेळ्ळो ना, सो तेज्या खातीर जस्टीस मेळपा खातीर दिस इज एंटायर प्रोटेस्ट इज गोईंग.
तुम्ही आता डीनाक आणि एमएसाक मेळ्ळे पळय तेन्ना कितें डिस्कशन जालें की
Dean and MS have been extremely supportive. Our Dean sir, Dr. S. M. Bandekar and Rajesh Patil sir have been extremely supportive in the protest. So तेमी सांगला की they are with us in this hard times that our colleagues has faced, and they will support us in the protest.